Thank you.
Thank you very much, and a very good morning and good afternoon to you all at the European Health and Fitness Forum. I'm very pleased to be able to join you, and I'm sorry I can't be there personally and physically with you, but I'm joining you from Geneva, from the World Health Organization, to share the opening session and talk about how important transforming physical activity through stronger partnerships is going to be for global health. And in talking about this, it's no understatement to say that health and humanity is really at a crossroads. As we meet now virtually in Glasgow, they're discussing critical issues around climate change and the actions needed to address planetary challenges. And in terms of the Sustainable Development Goals, which you're all familiar with, there's real clarity that much more needs to be done, and indeed more catch up now that we've had the experience of COVID affecting our progress. WHO sits as custodian to Target 3.4, and I know you're all very committed to helping achieve better health and well-being. And that will be measured by reducing the premature mortality from non-communicable diseases. And we all share a commitment to the contribution that physical activity can play to achieving that. We know it's got more to offer, but it has particular value to achieving a reduction in those leading causes of disease, the ones we know about, hear too much about: heart disease, diabetes, cancers. And physical activity can help prevent and help manage those conditions. We know it's good for health. We know it's good for all ages. And we have a target, an agreed target, to improve physical activity by 15%. And the partnerships between health and the health and fitness sector, private and public, is necessary. We look at the SDG wheel, and we know that by being more active, and the industries and the communities and the sectors that will contribute that will, of course, contribute to other SDGs. Healthier cities, which they're talking about in Glasgow at the moment, sustainable jobs, help the economy, address gender equity. And we know that being active can actually improve educational outcomes as well, and many others of these SDGs. The agenda is large, and we have, through COVID, experienced the challenges of delivering physical activity. The opportunity here, and shown in this slide, is a reminder that it's going to take all of us working together across a system to deliver an active society. Many of you, but not all, will know the Global Action Plan on Physical Activity, launched by WHO in 2018. Setting the agenda for that goal for 2030, 15% improvement, and calling for partnerships to implement policy actions and programs in 4 areas, color-coded and shown on this slide, creating a system. But it's not any one part of it, it's doing it all together. And that's why the theme of this conference, the challenge set by Europe Active for transformative change to improve impact, is so timely and shared by WHO. We tackled that question with the support of Europe Active, and many of your members and many of you will have joined us in a series that we took place over the last 6 months. We called it the Reinvent and Rebuild webinar series, a global forum discussing how can we do better to deliver that system I just showed. How can we do better together in delivering the opportunities for young and old, people of all abilities, in the private and the public opportunities, through sport, through exercise and fitness, through walking and cycling. We learnt a lot, and we learnt a lot from you, and we thank you for your contributions as panelists, as helping us to coordinate, but also as participants. It was a challenging discussion, but there was really some key messages. And those key messages were, we need to do better together to join up the dots, to join up and connect how each contributor to physical activity, from health, from exercise and fitness, from transport, from education, to make a much better experience and whole of community approach to promoting physical activity. What are the other key messages we learned? We really got confirmation that physical activity is a must-have in terms of health. I've mentioned that and I'll reiterate it. It's good for everyone at all ages, every day, in all its forms. We know it's a policy win-win. We just looked at that from the sustainable development lens for health and for other areas, the economy and the environment. We also learned we do know what to do. It was very clear from the science, from health, from all of the sectors that contributed, there's clarity and shared understanding of what's required and what works. But we were profoundly struck by the fact the system is currently delivering an unfair and uneven opportunities for people within Europe, across Europe, outside of Europe in other regions. There is disadvantage in the availability of safe places to be active, to walk and cycle, access and opportunities to be a member or to experience and participate, whether that's physical barriers, social barriers, or economic barriers. And we heard that whilst we recognize that it's unfair and uneven, we also are committed to addressing that. And so what is it we know we need to do and need to do in partnership? 3 strategic drivers: how we conduct and communicate physical activity, the opportunity to reach far more people with messages that are salient and really resonate and engage for the reasons they want to be active, not just necessarily the reasons why, for example, the health sector might say it will prevent disease. It must be fun and enjoyable and engaging and rewarding and satisfying. And the sports sector, the fitness and health industry really does know a lot about how to make that happen. That's why we need to be in partnership. The second, what we know, and the driver is the environments we create. And your sector is instrumental in creating those environments in your own settings, in your communities, making sure people can get to your settings and what you provide and how you provide it and the facilities, and informing and engaging the community leaders and city leaders to ensure the places and spaces are safe and accessible. We need to invest more in spaces for physical activity, sport, exercise, and fitness. And then thirdly, where of course many of us gravitate to and understand most, and that is the programs and services, whether it's virtual, which has clearly been the growth area in the last 2 years, or a combination of virtual, digital, and physical. And that, what we heard, was clearly the future. We know these 3 strategic drivers, these 3 policy actions, these 3 things we have to do in every community will change physical activity. But partnering is critical. Let me finish by inviting us just to reflect, how can we partner better between the health sector and the sport, exercise, and health and fitness sector? And I don't know that there's been a systematic evaluation of the strengths and weaknesses of that partnership. And I invite those in the room and across the conference to discuss this, and even following up, maybe some more formal assessment is needed, engaging all of the system. But there's absolutely value in the complementarity of the health advice and the health evidence being communicated through health providers in primary healthcare settings, connecting to and being supported by the programs and provisions and the environments. And if we don't bring the 2 together, we really are missing out. And that largely explains perhaps the lack of progress that we're seeing to date on physical activity. So it's essential because we're complementary. The second area is we need to partner better to build the legitimacy, the advocacy, the understanding around physical activity, developing standards and policies to lift the level of everyone, everywhere in the health and exercise and fitness sectors. Innovation would be another third reason why we should partner. Sharing capabilities, knowledge, experience, insights to improve our services and programs and to innovate new ways. Surely that is better together. And the shared learning will really be valuable across both sectors. And finally, we need the critical mass to scale and share. And so for 5 reasons, I suggest, and I think many of you will agree, we must look forward to this conference and going forward into 2022 and beyond, that we build the strength of our relationships and partnerships between the health sector and health and fitness industry and communities, so that we can deliver these 3 strategic drivers and deliver a more active, healthier world. And I wish you well in this meeting, and I wish I could have been with you. But thank you for the opportunity to start that conversation about strengthening our partnerships. Wish you well. Bye-bye.